So the Ozempic craze, I think, has changed all of medicine. Hell, all of the US, all of health. I mean, this drug is completely changing the whole fabric of America. There's something unique going on, something idiosyncratic, something very specific to Ozempic. And this is what I just published a paper on in Aesthetic Surgery Journal. I'm really excited about it. I did quite a bit of theoretical research. I presented this at the MCAS meeting in Paris. I believe that the Ozempic works by a unique mechanism. There's so many patients on this drug right now that are using it, and the results, frankly, have been quite fantastic for weight loss. It's revolutionizing a lot of the way patients look, but not only that, the way they feel. When I'm noticing patients are coming in, they're feeling a lot better about themselves. So as we're youthful, we have a lot of fat in our face, and fat makes us look youthful. Not only does it make us look youthful, it also adds growth factors and stem cells, and it helps the skin to regenerate quicker. It helps the skin by providing cytokines and growth factors. So fat is actually helpful to the skin in many levels. However, this Ozempic is really changing the way they appear. And while they started out with a full face, and when you have a lot of fat in your face, you look more youthful. Your face actually looks healthier when it's kind of puffy. As you lose fat in your face starts to look aged. And you see this with runners, like we have our marathon runners who come in who are maybe in their late 20s, early 30s, and they look like they're in their 50s. Something about getting very thin, especially in the face, really ages you. And everyone's assuming, well, Ozempic is just like everything else. You lose weight, so like a grape turning into a raisin, you have more wrinkles, but that's not the case. Ozempic is not working just by removing fat. It's not just losing volume in the face and everything's just wrinkling down like a raisin. You have 40% of Americans that are obese. If you look in Europe, it's around 20%. So there's many patients now who are trying to undergo Ozempic. They're thinking about undergoing Ozempic, or they're on Ozempic. And it's changing the way the economy, it's going to be influenced by Ozempic. So for treating the Ozempic face, for the patients who are on GLP-1 agonist medicines, I think the most effective treatment is probably doing a volume replacement procedure. So that could be a filler. However, a filler by itself does not seem to be getting the results that we would think we would get, or that we get in patients who are not on these medicines. And why is that? Because I believe that these fillers also work by stimulating adipose-derived stem cells, which have been turned off by the Ozempic or the GLP-1 agonist medicines. So fat has two different components there. One, it's using as a spacer, and it's augmenting the appearance of the face. It's filling it out. It's making it look more youthful, more bountiful. But it's also got another mechanism that works to stimulate the growth factors and stem cells within the dermis and epidermis. So without that fat, the skin looks more aged. So if we're going to be using a filler, we probably need to supplement it with another bioregenerative product. And I have some secrets on that. And if you want to come in, I'll tell you more about it. But I think there's ways to enhance or turbocharge the fillers so they get a better result. If someone decides they want to go under a more definitive procedure, well, then there's fat transfer and then there's surgical facelifting, both of which I think can give a definitive result, along with topping it off with a CO2 laser treatment to resurface the face. That to me is the best way to treat patients who have lost a significant amount of weight, volume, and their face is looking to have experienced accelerated aging from undergoing Ozempic or GLP-1 agonist medicines. So with patients who are coming in who are on the GLP-1 agonist or who have the Ozempic face and they've lost quite a bit of weight, I'm seeing them, a lot of them are coming in immediately looking for soft tissue replacements if in the office. But if they're looking for surgical answers, it's a surgical facelift. And usually I'll do a deep plane facelift on them. They tend to have quite a bit of lax skin in their neck. So I do a deep neck approach to really tighten up and reduce a lot of submental fat, which is still there, and I tighten the platysmal muscle, which is the sling muscle that goes around the neck. So that's very common for me to do on those patients. I may also put a little fat in them, which is a little bit controversial and a little bit I'm cautious with it, because if they are to gain weight in the future, you don't want their faces to get grotesquely distorted. So I put little bits of fat in certain areas of the face where I think they can benefit from it. This product doesn't only influence appearance and reduces weight, but it also makes people feel better about themselves. So when they come into my office now, their faces are very thin, and they're saying, Dr. Dan, I want to get treated because my face is very thin. I feel like I can maybe benefit. So do you think I can benefit from fillers? Now, when they come in, this is very interesting. This is very unique about Ozempic. Is they're not coming in because they feel like their faces look wasted or older. It's because they feel better about themselves And because they feel better about themselves, they're now investing into themselves. And now that they're investing into themselves, they want to see a facial plastic surgeon or an aesthetic provider. It's very unique. It's not they're coming and saying, Dr. I have all these wrinkles, come treat my wrinkles. Or I feel like there's hollowing in my cheeks or in my temples or around my eyes. They come in because they feel better about themselves. They want to know what they can do to optimize the way they appear. The Ozempic in particular, or semaglutide type products, or GLP-1 agonists, of which Ozempic is one of them, turns off the adipose-derived stem cells within the skin, in the upper layers of the dermis. And by turning off those adipose-derived stem cells, you reduce the ability to stimulate fibroblast production, collagen formation, elastin, and other ground substances that make the skin look good. So your adipose-derived stem cells are really critically important to the health of the skin. And if you turn those off, then the skin ages faster. Additionally, when you're heavy, you have a lot of fat in your dermal fat cones, which are little fat pouches that go into the dermis coming from the subcutaneous tissues. That fat reduces as you lose weight. When you're postmenopausal, the fat in your body, especially near the dermis, helps with estrogen production, and that relates to improvement in skin. Estrogen helps the skin look better, and we know that from those women who are postmenopausal who then go on estrogen replacements, their skin looks better. So if you reduce the amount of fat in the skin, you reduce the amount of estrogen at the level of the skin, and you turn off the adipose-derived stem cells, the skin starts to age and look older faster. So it's not just you're losing fat, you're turning off these mechanisms and these factors, these growth stimulating factors, and you're turning off the estrogen, you're turning off the adipose-derived stem cells, and that's why they're looking older. So if we're going to treat them effectively, we have to replace what's lost. And not just fat, but we have to find a way to turn on the adipose-derived stem cells or stimulate them and or put fat near the surface of the skin. So the areas of the face that I see most commonly affected by the Ozempic or the GLP-1 agonist drugs are probably the cheeks, the temples, and the hollows around the eyes. So I can see the fat loss there, and it's pretty obvious to me. But that's not necessarily what the patients are coming in for. And this is really a unique aspect of the patients who are on these products, is they're not so unhappy with the way their face looks. They've been heavy for a long time. They love the thinness they feel in their body, but they also tend to like the thinness they see in their face. So while they may have hollows in their cheeks and their temples and around their eyes, and I may say, let's treat these areas, they often come in saying, Dr. Dayan, my neck looks loose. Because they lose the fat in their neck, they see the loose and the hanging skin. So that's the area they most commonly request me treating. So any patient who's experiencing volume loss who wants to see an aesthetic provider should go to someone who's highly experienced and highly credentialed. There's no doubt the more experience someone has, the more likely you're going to get a better result. Going to someone who's just been doing this for a few years, who doesn't have a lot of experience, can pose risks that are unnecessary. So if you want to undergo treatment for Ozempic Face or those who are on the GLP-1 agonist, I recommend going to someone who's treated a lot of these patients, because likely you're going to need something more than just a filler. You're going to need if you want a definitive treatment, you're going to need a surgical procedure, which may include fat transfer and a facelift or a laser procedure. So it's important you see an experienced physician, especially if you're going to go a facelift. You're going to want to see a surgeon who's done quite a few of these. If you're going fat transfer, someone who has a lot of experience with fat transfer, and someone who really understands the nuances of what happens to the face when on Ozempic or GLP-1 agonist treatments.